At the Jocham Hospital, we are first guided into the donning room. Here, we are suited up in proper preventive gear before proceeding to the isolation and treatment centers. The world is battling an enemy equipped with a deadly, sneaky arsenal and has perfected the art of stealth. And so we are closely monitored by medical professionals. Every piece has to fit perfectly. We first head to the hospital's isolation unit. Here we meet a patient anxiously waiting test results. She was brought here after exhibiting symptoms of the disease.
Ndugu zangu mlio nje, dada zangu, kunao ugonjwa na ni muhimu sana kujikinga. Ugonjwa upo kuanzia mchanga mpaka anayezaliwa. Kwa hivyo tujikingeni, tufuate sheria vile zinavyotakana.
We then head to the red zone, the actual war room, where patients and doctors have drawn their daggers and jumped headfirst onto the battlefield.
Anaogopa huyu.
Bila sasa utueleze umekuwa ukikabiliana vipi na maradhi ya COVID-19?
Swali ngumu.
Tuanzie tu safari yako tangu
safari yangu. Okay. Kwanza vile naona tuko wawili. Mwenzangu kulikosa maji kwa nyumba. Akaenda kubeba maji kutoka kwa fereji akiingiza kwa nyumba. Then after 2 days akasema kidogo anasikia mkono unamuuma. So tukaona ni kitu cha kawaida. Tukamwambia meza painkiller. Akameza. After almost 1 week nikaanza kuona anasikia baridi. So ikabidi ni book appointment na daktari. Tuende tuone bila atasaidika. So tulipoenda wakapata temperature yake imepanda kidogo. Daktari akasema the temperature is on the borderline. So daktari akaona wapima waone kama there's fever. So wakapima damu, wakatuambia ako na fever. Lakini kwa sababu ilikuwa hiyo temperature iko kwa borderline, tukaamua tu wampime pia COVID. So that was on Monday. Karudi nyumbani kwa mesa zile dawa alipewa. Tukaanza kuona fever ilikuwa imepungua. Kufika Wednesday akapata simu. Kumwambia kulingana na ile fever vile ilienda, inaonekana you are a positive case. So tukafanya arrangement, akaletwa hapa. Sasa nilipoona ameletwa hapa, mimi sikungoja sababu niliambiwa inashika haraka na hasa bila nimekuwa naye. So mimi pia nikajipeleka hospitali. So nikifika kwa mlango huwa kuna mahali wanapima kwanza temperature, ndio waambiwa where to go. So alipopima my temperature akaona it's normal. Kaniambia wewe mzee nenda. Kamwambia yule sister hapana, mimi najua temperature iko normal, lakini niko hapa kwa sababu mwenzangu alikuwa hapa and as I'm talking to you she's admitted, so lazima nipimwe. So arrange kupima. That was on a Friday. Ilipofika Monday morning nikaambiwa fuata mama penye mama alienda. So tukafanya arrangement, nikaletwa hapa.
And thus began the difficult journey of isolation and treatment.
Kama kila mtu angepata environment kama hiyo tumepata hapa, that could be the best thing that can happen. Kwa sababu nilipoletwa hapa nilikuwa najua naletwa kama mtu mnaenda kutafuta matibabu. So nitawekwa wherever I will be. Lakini nilipoambiwa hey ingia hapa, nikapata hata mwenzangu yuko hapa. You know, I felt very good. Kwanza nikaona hii unajua we are in our last hiyo miaka yetu imesonga kidogo. Nikaona huyu madaktari amenileta kwa honeymoon. But now na honeymoon minus other things because we're so not at a spacing so nikaona nimeletwa kwa honeymoon. So in fact aliponiacha nyumbani ningempigia simu angenijibu, but kama binadamu there are things I could feel, maybe sijua nasikiaje, but now right now we are together. Okay, in fact hata yeye sasa amekuwa more encouraging, tunazungumza mambo yetu ya kawaida, na ikifikia hapo she's more encouraging. Vile unaona sisi bado tuna nguvu, and we have our Bible here. Ikifika usiku hapa nafikiri we are the prayer warriors in this house.
Amen.
Yeah.
In another word, we find a younger patient, the burst of good cheer in her eyes, masking the pain she has been battling.
I'm positive. Na niko na hizo signs zote. Si ati kwa lazima nianguke ama nikose pumzi ndio kwa. For me, yani inataka mtu ukue strong. Kwanza ukue strong na ukubali, ukue na imani. Na wale wenye wako huko nje wanadhania kama mimi nitakufa ama turn back. Bora tu ufuate maagizo, ukunywe dawa, ukule, unakuwa tu utakuwa sawa. So hakuna mtu anaweza maybe siku yako ikifika ndio utakufa. Na hii kitu okay, kuna vile utakuwa weak, lakini you have to fight, you have to put on faith, like utasema inshallah mimi nitatoka.
Dr. Menga Chiringa is in charge of treatment of COVID-19 patients at the Jocham Hospital. His daily routine involves monitoring how each patient is responding to treatment.
They are stable, just covering them from irritation of the throat and protect them from chest infection.
What type of medication do you administer to COVID-19 patients?
You see, most patients present with different complaints, so we manage each complaint we manage the complaint with the medication. Some just come with cough, most of them are symptomatic, and for those who come with coughs, we protect them from chest infection. We give them antihistamine to sedate the irritation and the coughing. We even boost their immunity and yeah.
Any specific types of drugs?
It also depends, because some don't have even symptoms, but mostly we cover them with like azithromycin and antihistamine, that is either cetirizine, paracetamol, and also vitamin C. Those are the main which we normally use.
They are stable, not even a single patient on oxygen. We haven't experienced any patient complicating to warrant HDU or more intensive care.
Some of the patients here are referrals from the Kenya Ports Authority, Bamburi and Mvita, which hosts Old Town, the geographical zone with the most number of cases in Mombasa County.
Confirmed patients are like 8, and we've discharged 6 patients who are now stable with the negative results. And currently we have 2 awaiting results and 2 are confirmed cases. The ones which are waiting the results are in the isolation, and the other ones also are in the other red zone isolation.
Life in the red zone is an everyday hope for the best possible outcome amid the anxiety and stigma that come with the virus.
Baadhi ya watu wanasema, wananiongelea, yani wanaongelea vibaya, huko ana ugonjwa, ni tu hospitali, umekaa tu hospitali hivyo.
Majirani wanakuona ukikohoa, wanakutenga, wanakaa kando na wewe, wanasema kando, huyu onekana, huyu onekana. Na unajua ugonjwa uzidi usiku. Na kila mtu amelala, kila mtu anakusikia unakohoa.
And like any battle, there will be casualties. The Ministry of Health says up to 34 health workers have tested positive, and Jocham Hospital has not been spared. A nurse caught the virus after coming into contact with a patient.
To date, we've tested about 40 staff. The first test of 19 staff, we got 1 staff who turned positive. But now that staff was working in our patient department. That was a nurse. on tracking the patient that she may have come into contact with, there was one patient who was positive eventually, but who was later on transferred to Coast General.
Perhaps maybe when you get out of this place today, when you get home, how do they receive you?
For the children, yes, they take me as their father, but for my wife, no, she's very careful. Before I get inside, I have to remove everything at the doorstep.
But outside the confines of this facility and into the heart of Mombasa Old Town are the deniers and naysayers who rather wish away the existence of the virus. A week ago, the Ministry of Health sounded a stern warning to residents there who flouted the measures with reckless abandon.
Wengine wanapuzia, wanasema hii ni government scam, hakuna kitu kama hiyo inatokea. Mimi nimetoka vitu kwa mapua, kwa mdomo, unaona, like hizo makohozi, unaona. So hii kitu iko.
Is COVID-19 real?
It is real, and this disease, it is going to affect most of us if we are not watchful. The government is sending messages all over, everywhere. Stay at home, stay at home. This disease is being spread by the droplets. When you get in touch with the droplets and maybe you touch your face, any opening, the disease might infect you.
The worst thing you can do in life, in the general life, ni kukata ushauri. Ukiangalia ile bidii serikali imeweka, it cannot be doing that if that's a joke.
Mombasa County is the second most affected in the country after Nairobi. Also alarming is the number of deaths in the county, at least 15. More than 5 deaths here have occurred at home, and the question of how to handle the bodies has been on the lips of many.
The body is temporarily stored, but it is wrapped in a waterproof polythene, then put into a sealed body bag, and these bodies have to be disposed within 24 hours.
The World Health Organization says there is no evidence of persons having become infected from exposure to bodies of those who died from COVID-19. But with the fluid novel of this disease, the boundaries remain an ever-shifting bloodline. Back at Jocham Hospital, our watch has ended, and it's time to give way for the doctors to pick up from where they left. But not before we free ourselves of the protective gear. Kevin Mutai, NTV, Mombasa.